ROUSE-1 is a randomized, double-blind, parallel group, single-center, phase 1b/2 study to assess the safety, tolerability, pharmacokinetics, and pharmacodynamics of 3 orally administered doses of enoxacin in adults with amyotrophic lateral sclerosis. There are currently no curative therapies for ALS, with only 2 disease-modifying therapies approved, riluzole and edaravone. Many of the ALS-causing mutations that have been identified are mutations in genes that code for RNA-binding proteins. It is therefore hypothesized that dysregulation of RNA activity may be involved in the pathogenesis of ALS. MicroRNAs are downregulated in the motor neurons of people with ALS, with further evidence suggesting that this may be the result of impaired dicer activity. Enoxacin is an antibiotic from the fluoroquinolone group of antibiotics that could partially rescue the reduction in dicer activity and have a further downstream effect on microRNA levels. The effects of enoxacin on microRNA levels may impact the expression of key proteins involved in the pathogenesis of ALS. Preclinical data supports the testing of enoxacin as a disease-modifying therapeutic for familial and sporadic ALS, leading to the development of the current trial. ROUSE-1 is being run at a single center, the Montreal Neurological Institute and Hospital. 36 participants will be enrolled, with each participant receiving one of 3 oral doses, 200, 400, or 600 milligrams daily. The primary objective of the study is to examine the safety and tolerability of the 3 oral doses of enoxacin. Secondary and exploratory objectives include evaluating the pharmacokinetics of enoxacin, characterizing the functional capacity and disease stage of the study population, and examining the pharmacodynamics of enoxacin.
The main inclusion and exclusion criteria are shown. Participants must be between the ages of 18 and 85, have a diagnosis of familial or sporadic ALS, be less than 36 months from symptom onset, and have a forced vital capacity of less than 50% at screening. Be stable on current medications and refrain from taking prohibited medications. Participants should not have significant medical conditions, including other neurodegenerative conditions, that would preclude their enrollment in the study. Participants will undergo a screening period of up to 28 days, then be randomized into one of 3 doses of enoxacin taken orally twice a day for 30 days. Participants will be seen on days 1, 7, 14, 21, and 30 for study visits, including regular safety follow-ups, pharmacokinetic testing, and pharmacodynamics testing. A final safety follow-up visit will take place on day 44. The study has obtained a no objection letter from Health Canada and also ethics approval. The study is now recruiting, with a study completion expected by December 2021. We thank Apotex, the funding agencies, Weissman Canada, and Dinah Lehmanis for their support. This project is also supported by an ALS Canada, Brain Canada project grant.